Wonderful. Well, like Will said, I am Allison Masters. I'm one of the cardiologists here at the University of Minnesota's Veterinary Medical Center. And tonight we'll be discussing how we can recognize signs of heart disease in our own pets and recommendations for early detection, early treatment, and even prevention of heart disease in cats and dogs. I'll begin this evening with a brief refresher of some of the many important roles that the heart plays. It may or may not have been a few years since our most recent biology course, and this will be helpful for us to understand so that we can better know what to look out for as far as signs of heart disease in our own pets. So first and foremost, the main job of the heart, of course, is to pump blood. The heart is a pump, so it needs to be able to generate enough pressure to pump blood both to the lungs, where it can receive oxygen, and then, of course, to the rest of our body, where it can nourish our cells and tissues. And then subsequently, the heart needs to be able to relax so that it can fill once again with blood before another pump. The heart also needs to be able to control the direction of blood flow. There are 4 different valves within the heart that open and close depending on whether the heart is pumping or relaxing, and that allows for the control of blood flow direction and to make sure that blood's always moving forward through the system. The heart also needs to be able to deliver oxygen and nutrients to the entire body. So the heart is going to be responsible for pumping blood from the body to the lungs so that that blood can receive oxygen. And then, of course, blood from the lungs is returned to the heart and pumped once again to the rest of the body. And last, but certainly not least, the heart can never stop. There's a constant flow of electrical activity throughout the heart. That's what we are looking at when we're looking at tests like an EKG, shown here on the slide. And that ensures that our heart never stops pumping. In general, the heart is a system that's got 2 sides to it. There's a right side of the heart and a left side of the heart. The right side of the heart is going to receive blood from the body. It's going to return to that side of the heart and enter into what is called the right atrium. That's where it's going to flow through one of the first valves in the heart here, the tricuspid valve, into our right ventricle, where it is then pumped out through the pulmonic valve into the lungs, where it gets all that nice oxygen, and then returns to the heart, but this time on the left side, into that left atrial chamber, through another heart valve known as the mitral valve, into the left ventricle, where it's then pumped through the aortic valve and back out to the body through our aorta. So why did I make everyone go through Biology 101 again? Well, that is because anytime one of these important jobs of the heart are disrupted or not allowed to occur, then that is going to result in heart disease in our pets. And so what are some signs of heart disease that we can look out for in our pets? What might be some clues that they would be showing us that would suggest they could have heart disease? If our pet is having an issue with pumping their blood, if their heart is not pumping adequately, that's when we'll see signs such as a decrease in their energy level. We can see them become weaker or even less playful. Maybe they used to run in the yard and catch their tennis ball for hours at a time, and now they're not able to do that. Can't go as far on walks as they used to. We can also see things like pale gums. I have a picture here on the right-hand portion of this slide showing a dog's mouth, and you can see his gums here are quite pale white. They should instead be a nice deep pink to even dark pink color. And then in more significant cases, we can even see our pets fainting or having episodes where they collapse. If there's an issue with the heart's ability to control the direction of blood flow, then that is when we will start to see blood and ultimately fluid backing up into abnormal parts of the body. So that can look like difficulty breathing if there's fluid backing up into the lungs or the airways. That's where we can see coughing or gagging. I did see somebody had a really good question about whether or not gagging or hacking after eating and drinking in a pet is a sign of heart disease. And I can answer that now and say that in general, no, that's not going to be a sign of heart disease in cats or dogs if it is only associated with eating and drinking and not occurring any other time. That is more likely a result of irritation either of the back of the throat or of the esophagus, but thankfully not typically a sign of heart disease in those cases. We can also see fluid backing up into the abdomen, and that will look like a distended belly. So you can see this dog here on this slide is overall a pretty skinny dog. I can see all of his ribs here, but this dog has what looks like a pot-bellied appearance despite being skinny because there is fluid in his abdomen. And this can also result in episodes of fainting and collapse as well. If there's an issue with getting oxygen out to the body, then that will look similarly to what we just described. So that will manifest as changes in breathing, coughing or gagging, changes in energy level, weakness. And then this is where we can see cyanotic mucous membranes or gums. So gum with a blue or purplish color to it, like this cat on the upper part of this picture here. And then if we're having problems with the heartbeat itself, that is usually because we're having what's known as an arrhythmia, an abnormal heart rhythm. And when that occurs, that will often cause fainting or collapse, but can also cause decreases in our energy level as well. And then I wanted to mention a special thing that cats do. So this is really a cat-only thing here. Dogs don't do this. But when cats get heart disease, they unfortunately are at risk for developing blood clots within their heart. And if those blood clots leave the heart, then that will result in things like stroke, or more commonly, we'll see those blood clots going to the cat's legs. And so that might look like your cat suddenly being unable to use one or more of their legs. You can see this Persian cat here on the bottom right-hand part of the slide is dragging his back leg here because he cannot use it anymore. These cats will also be painful or uncomfortable. They may even be vocalizing because of that pain. And then you may see that their paw pads turn pale or even purple in color, which I'll jump a couple slides back here now, bear with me. But this cat's paw pads are a purple color, so we can look for that as a sign of blood clot in cats. Ultimately, if we're seeing any of these signs of heart disease in our pets, that could mean that they have heart disease that has ultimately caused their heart to start failing. And that's a syndrome known as heart failure. Heart failure is a medical emergency in pets. It can be managed quite well with medications, but heart failure can also be fatal in pets. And so what I would like to do with the rest of our time together is focus on how we can detect heart disease in our pets if present before they start showing these signs or before they start having heart failure, because we can all agree that would be the preference would be to detect these conditions early in our pets. At the end of the day, the number one best tool that we have for early detection of heart disease in pets is our annual wellness exams with your primary veterinarian. So if you have made it a habit to take your pet to the vet annually, even when they are doing well, then I would like you to give yourselves a big pat on the back, because that is the best tool that we have for picking up on heart disease as early as possible. And the best tool that we have that we use during these exams is something called cardiopulmonary auscultation, which is just a fancy way of saying that your veterinarian is using a stethoscope, which you can see here on this slide, to listen to your pet's heart and lungs. When we're listening to your pet's heart and lungs, the things that we're listening for that could mean your pet has heart disease would be the presence of a heart murmur, so an abnormal heart sound that is associated with blood flowing in the wrong direction in the heart. We can also listen for abnormal heart sounds like gallop sounds or clicking sounds. And then we can listen for those abnormal heart rhythms as well, those arrhythmias that mean that the heart is not beating appropriately. If your veterinarian appreciates any of these abnormalities when they're listening to your pet's heart, then there are a number of tests that they may or may not recommend, depending on what they're hearing on the cardiopulmonary auscultation. But tests that we'll often consider would be chest x-rays, so taking x-rays of the heart and lungs to look at the overall heart size and shape. We can do an EKG to look at the heart rhythm and to assess for any arrhythmias that may need to be treated. We can also do a test known as cardiac biomarker testing. These are different proteins and hormones that can be measured in your pet's blood. So a blood sample submitted and looking for these cardiac biomarkers, which can be elevated in pets that have heart conditions. And then your veterinarian may recommend referral to a veterinary cardiologist depending on the results of these tests as well. I put this slide in here. I realize it's a little bit busy, but I wanted to touch on some recommendations that are specific for our senior dogs and cats. And so senior dogs and cats are those dogs and cats that are in roughly the last 25% of their life expectancy. Of course, we always hope they live longer than that, but we know that senior dogs and cats are at the highest risk of developing heart disease, as many heart conditions don't affect animals until they are older. And so AHA, the American Animal Hospital Association, has published some recommendations for testing specifically in dogs and cats as they get older. And some of these tests are going to be screening specifically for heart disease. So I'll point a few of them out here. Annual heartworm testing is recommended to make sure your pet doesn't have any evidence of heartworm, which is a disease that affects, a parasitic disease that affects the heart. Imaging testing, that's going to be things like x-rays or ultrasound, may be recommended if your pet has an abnormal cardiopulmonary auscultation. So that's always the first step in these pets. And same goes for the electrocardiogram, that's the EKG test. That's going to be recommended if there's an abnormality on cardiopulmonary auscultation, or you'll see sometimes in certain breeds that are predisposed to heart disease, like boxers and Dobermans, will also perform that test annually on them once they reach a certain age. And then the last one down here that I wanted to point out is a test called an NT-proBNP. This is one of those cardiac biomarker tests, so it is a blood test, And AHA recommends that that is assessed annually in senior cats and dogs, and then also making sure that we're assessing that prior to any planned anesthetic events. So senior cats and dogs also often frequently need dental cleanings, and this would be a test that could be helpful to screen for heart disease before anesthesia for something like that. So that's all well and good if we can detect the presence of heart disease prior to the development of heart failure. What then can we do about it? What are our options for slowing down the course of the heart disease or helping prevent heart failure in these guys? And ultimately, there are a couple of options, and more every day, thankfully. But specifically, what we have at least the most evidence for in our dogs, I'll start with dogs here. We know that a medication called pimobendan, or the brand name of this medication is called vetmedin. This medication has been shown in several studies to slow down the progression of two of the most common heart diseases in dogs. So the most common heart disease by far and away that we see in dogs is a condition known as degenerative mitral valve disease, or myxomatous mitral valve disease. Pimobendan has been shown in several studies, including one that I linked here on the slide, to slow down the progression of this condition and prolong the time until dogs with this condition develop heart failure. And so this is a medication that we're often utilizing in dogs with degenerative mitral valve disease to slow their disease down. And then the second most common heart condition that we see in dogs is something known as dilated cardiomyopathy. And this medication has also been shown to slow down the progression of dilated cardiomyopathy as well. So common medication that we use in pets with early signs of heart disease. Skipping now over, of course, to our kitty cat friends. Unfortunately, there have not been any medications to date that have been shown to slow down the progression of any cat heart conditions. So that is not something that we currently have the ability to do. But I did mention earlier that cats will get blood clots when they have heart disease. And we can start cats with heart disease on blood thinners like Plavix, and that will dramatically reduce the risk of these cats developing blood clots, which can be fatal. So we still have options to help with some of the complications that we see with heart conditions in cats. And then if you are super in the know, you may have seen in the last couple of weeks that the FDA recently announced conditional approval for a drug to be used in cats with early signs of a condition known as hypertrophic cardiomyopathy. And that is the most common heart disease that we see in cats. It can affect up to 15% of cats in their lifetime. So it is a really big deal. And I'm really excited to see this announcement. It's for a drug called Felicin, or sirolimus is the generic drug compound. It is currently being investigated in a large multi-center study known as the HALT study. If you go to this hcmandcats.com website, it links you to a bunch of information about the HALT study. But that study is currently looking at using this medication in cats with early HCM and seeing if the medication prolongs their lifespan or prolongs the amount of time before they develop heart failure. So we don't have this information yet. This is currently being looked at. That is why the FDA only provided conditional approval for this drug. So it's not something that we're currently prescribing to cats. But if you are interested in your cat participating in this HALT study, if they're a candidate, then I would recommend visiting this website You will need your veterinarian to help you enroll in this study, so that's something that you'll want to reach out to them for. And then, of course, if you're a client of ours here at the University of Minnesota, thank you. And if you are interested in more information about this study, or if your cat's a candidate, please, of course, reach out. My contact info will be at the end of this presentation. And then there are many supplements that have been shown to have significant cardiac benefits. A big disclaimer here, these are all going to be really individual dependent. So I will provide some general recommendations, but at the end of the day, consulting with your veterinarian about your individual pet is going to be important here. But some of the supplements that we know have cardiac benefits are going to be things like omega-3 fatty acids. So those are things like fish oil supplementation. We also know that taurine and L-carnitine in some dogs can be helpful with heart pumping function. And then CoQ10 is an enzyme that has also been shown to be helpful in dogs with heart disease as well. And then, of course, at the end of the day, the best case scenario would be preventing our pets from getting heart disease in the first place. And so I want to go over some options that we have for prevention of heart disease in our pets. I will acknowledge up front that, unfortunately, the vast majority of heart conditions that we see in pets cannot be prevented. They are often inherited and not something that, for instance, lifestyle modification can address or prevent. But things that we can prevent, heartworm disease is a big one. So heartworm disease is a parasitic disease that is caused by mosquitoes. And it is a condition that we thankfully have some very effective preventative medications that can essentially eliminate your pet's risk of getting this condition if administered regularly. And so the biggest recommendation that I have for prevention of heartworm disease in pets is using year-round preventatives. You can talk to your primary veterinarian about what preventative options might be best for your pet. Or this American Heartworm Society group has a really helpful website that goes through a lot of the preventative options available for pets. And then annual testing for heartworm disease is important as well, especially if there's been any lapse in preventative administration. And then I put this map on here. You probably have noticed it's from 2007, which I'm a little sad about how long ago that's been now, but I just wanted to show what we've been seeing with the trend of heartworm over time in this country, at least. So you'll see this map from 2007 shows that the kind of southeastern part of the United States is where we see the most heartworm disease, which makes sense. There's a lot of mosquitoes in that area, and that part of the country tends to stay pretty warm year-round. But us up here in the Twin Cities, we're dark enough red to be concerned about that as well. But what you can see is, even though many pets are receiving preventatives, still not enough pets are getting preventative medications. So this map is from 2016, showing even more of the Southeast United States being significantly impacted by this. And then the most recent map that we have is from 2022, and it concerned me because I selfishly looked up here at our Twin Cities dot and saw that we have a pretty high incidence of heartworm disease in this area. So I don't know about you, but today was a nice day. I took my dog outside for a walk and I got at least one mosquito bite while doing so. So a very important thing to keep in mind, even though we're fresh off of the winter months and may have forgotten about the existence of mosquitoes. Another tool that we have to prevent heart disease in pets is diet. So at the end of the day, it won't come as a surprise to anyone that the most important thing to do for our pets with regard to diet is just making sure that we're providing them with a fully balanced diet that meets all of their protein, carbohydrate, and fat needs, as well as their micronutrient needs. This is something that admittedly is quite nuanced, but at the end of the day, the two best options that we have for feeding a balanced diet are going to either be feeding a commercially available diet, so a diet that you can buy at the pet store or at the grocery store that meets the World Small Animal Veterinary Association nutrition guidelines, or WSAVA. WSAVA is a global group of veterinarians that put out expert guidelines on many things, including nutrition and pet foods, and they have tons of really helpful resources. I've put a QR code to probably the most useful from a pet food selection standpoint. So this is going to take you to a PDF that has kind of step-by-step instructions to make sure that whatever diet you are feeding your pet or are interested in feeding your pet meets these guidelines. Because as you'll see, I put this on the slide. I didn't want it to look too busy, but this is another resource from WSAVA that walks you through how to understand your pet's food label, because it's just completely different than the nutritional labels that we're used to looking at when we go to the grocery store and buy foods for ourselves. So not something that I'm going to delve into here tonight, but just a resource I wanted to put out there for anyone that is interested. And then, of course, the other option that we have for feeding a fully balanced diet is homemade diet, but I would just really recommend or advise that this be under the direction of a veterinary nutritionist, because this can be really nuanced and be really individual dog dependent. So thankfully, there's more and more access to veterinary nutritionists these days with different online tools. But if this is something you're interested in, I would recommend reaching out to your vet, seeing what sorts of tools they have to get you in contact with a veterinary nutritionist to come up with a food plan for your pet at home. And then I put these ingredients to avoid down here. You may or may not have come across this. It's been about, oh gosh, maybe, 7 or 8 years now. So it's been a little while. It was pre-COVID-19 pandemic that this happened, but we were seeing an uptick in cases of dilated cardiomyopathy in dogs that were being fed certain diets. And at the end of the day, we never figured out exactly what was causing that heart condition in these dogs. And many of those pet food diets have been changed now, so we're not seeing it nearly as often anymore, thank goodness. But what we noticed at that time is that a lot of the diets associated with the heart conditions that we were seeing had pea or pea products in them, legumes, or sweet potatoes. So I put this on here. If those are in the diets that you're feeding your pet right now, please don't panic by any means, but it may warrant a discussion with your veterinarian to make sure that that's a good diet for your pet to be on. And then the kind of last prong that we have as far as prevention of heart disease goes in pets is genetic testing. So there are several genetic tests available for various heart conditions in specific dog breeds. And so it's highly recommended that any dogs that are used for breeding be screened for any genetic conditions that their breed is at risk for. I've put this picture up here. The OFA, or the Orthopedic Foundation of America, maintains the Canine Health Information Center database that gives guidelines for every single dog breed that's recognized by the AKC on what sorts of genetic tests they should have done before they're used for breeding. And so this is a good resource for you if you are looking to adopt a purebred dog. And certainly this is a really important resource for anyone who's looking to breed dogs. As far as genetic testing for individual dogs goes, that's a little bit more challenging. So this would be, is it worth it for me to do genetic testing on my own pet at home who I have no plans to breed? And in general, it's not as useful because most heart conditions that have genes identified that we can screen for aren't inherited in a way that just because your dog has the gene, they will get the disease. That's not the case. If they have the gene, they may get the disease, but it completely depends. So as we see commercial genetic testing becoming more and more common, just like it is in humans, if you see that your pet has a gene that's been associated with heart disease, I would certainly not immediately panic. I would consult your veterinarian and see if there's anything you need to be doing about that, but just know it's nuanced. It's not that simple. They have the gene, which means they're at risk, but it doesn't mean they will certainly develop the condition by any means. And so I wanted to sum up here briefly before getting into questions, because I think this is a topic that provides for lots of rich discussion. So I want to make sure we have time for that tonight. But just to sum up what we've chatted about so far, signs to look out for that might suggest that your pet could have heart disease include things like difficulty breathing, coughing, or collapse or fainting episodes. As far as early diagnosis and treatment, there are options for early treatment of heart disease, and so early diagnosis is really important. And the number one thing you can do for that is to just make sure to stay on top of your pet's annual wellness visits with your veterinarian. And then as far as prevention goes, making sure that we're giving our pets their heartworm preventatives, that we're feeding them a balanced diet, and then genetic testing in certain circumstances, like in breeding animals or prior to adopting purebred dogs, is also helpful for prevention of heart disease. I wanted to give a huge thank you to everyone that is here tonight, all of the clients of University of Minnesota's Veterinary Medical Center, especially my cardiology clients and patients. You allow me to do what I do every day, and so thank you very much. This QR code will take you to the cardiology website for our group here at University of Minnesota. That's going to include information on how to get in contact with me or with the cardiology service here, and if your pet would benefit from a cardiac assessment, it'll walk you through how to set that up. And then it also just has some what I think are nice stories from some of our patients as well. So I wanted to throw that on this slide as well. But with that, what questions can I answer?
Thanks so much, Dr. Masters. Really appreciate your wonderful presentation. We have some pre-submitted questions from folks who did that during registration, so we will jump in. This one is around the topic of aging, age differences. Are signs of heart disease and/or heart failure significantly different in young dogs versus senior dogs?
That's a really, really good question. And as you probably noticed throughout my talk tonight, I focused mostly on what to look out for as far as signs of heart disease in dogs and cats as they get older, because that's what we see most commonly. But we know that any animal is at risk for being born with a heart condition. So that's something known as a congenital heart disease. And at the end of the day, the signs that we look out for in those young animals are pretty much identical to the signs that I mentioned at the beginning of this talk. And that all circles back to any heart disease is going to affect one of those jobs of the heart, sometimes more of those jobs of the heart. And depending on which job of the heart is affected, you're going to see the signs associated with that. So each one of the congenital heart conditions that we see is going to impact one or more of those jobs. And so as long as we're looking out for all of those signs, they'll look the same in young animals and old animals.
Great, thank you so much. This next one has to do with breeds and genetics. Are certain breeds more likely to develop heart issues?
Yes, that is another great question, and a question that could encompass its own talk entirely. But the short answer is yes. Certain breeds of dogs are more predisposed to heart disease than other breeds. And that OFA chick database that I showed on the genetic testing slide actually has every single breed in there. And if you click on it, it will tell you exactly what heart conditions it's at risk for, if any, and how you can test for that. So if you're interested in a specific breed, that's where I would direct you. What I will say is, in general, we know that smaller breed dogs are at risk for that degenerative mitral valve condition that I mentioned, and larger breed dogs are at risk for that dilated cardiomyopathy condition that I mentioned. So those are kind of some general bits of information I can provide about genetics. But at the end of the day, that OFA website will have all the info that you could ever need or want regarding that.
Thanks, and we'll be sure to take that resource and others you mentioned in our follow-up email.
Thanks, Will.
Yep, we have a question here about DCM testing. Is there an accurate test available to show dilated cardiomyopathy in dogs?
Yes, another loaded question. So dilated cardiomyopathy is the second most common heart condition that we see in dogs, and it's quite complicated because it is often caused by genetics, so by certain genes that your dog has. But as I mentioned, it can be caused by just about anything, including diet. That was one of the reasons that what we feed our pet is so important, and other conditions can cause it as well. So it is a nuanced disease, certainly, and the biggest challenge with that condition is you can develop dilated cardiomyopathy and not have any abnormalities on that cardiopulmonary auscultation that I mentioned. So that's your veterinarian listening to your dog's heart and lungs during their annual wellness exam. Many times you will have an abnormality, but you don't have to. So at the end of the day, what you will see, and what is my recommendation as well, is that the gold standard for screening for that test is to do a test known as an echocardiogram, so a cardiac ultrasound. That's the most sensitive way to screen for that disease in any animal, and that's because we can physically look at your dog's heart pumping and measurements of heart pumping function and determine whether or not that's abnormal, which is the hallmark of that condition.
Thank you so much. All right, we have a question here. You talked about heart disease and other heart diseases being hereditary conditions. Is it more likely to be the male or the female gene? Sort of a detailed question there.
No, a very good question. We've got some geneticists in the audience. I won't pretend to be one, but a really good question. So I'm trying to think of the most succinct way to answer that. And I think that the most succinct way to answer that would be many of the conditions are not sex linked, so they will occur equally in males and females. However, there are several dilated cardiomyopathy in certain breeds, like Great Danes being one of them, where they are sex linked. And when that is the case, they're going to happen more commonly in males. But it's condition dependent, and I could talk your ear off forever about it. You're totally on the right track. And depending on the condition, it can be more common in males and then a couple more common in females.
Great, thanks. This one is asking about heart murmur detection. and working with their primary veterinarian. How is it possible that sometimes there may be a case where after years of routine annual exams and physicals, that suddenly a later stage heart murmur is discovered, seemingly for the first time? Did my veterinarian miss something that they should have been checking for sooner? How fast can a murmur develop?
Another really good question, and again, gets into the nuances of these things. So you're totally onto something there. In general, in most cases, your dog or cat will have a normal cardiopulmonary auscultation for most of their life. And then at some point, if it becomes abnormal, it will start at what we call a low grade, and then it will advance to a higher grade. That is usually what happens. Although, unfortunately, in some circumstances, and I'll give an example of the most common circumstance, but in some circumstances, a dog with no heart murmur or a cat with no heart murmur can suddenly develop a very loud heart murmur. And the most common time that we see that, I'll give an example in dogs because this is the most common time we see it, is if a dog has that degenerative mitral valve disease condition, which I keep mentioning, I'm like a broken record, but that's the most common heart condition we see in dogs. If they develop that condition and develop something known as chordal rupture with that condition, which is just a complication we see with that condition occasionally, they will go from having no murmur at all to having a very loud murmur. And so it is certainly not the majority of instances where we see that, but we absolutely can see that. And at the end of the day, the next steps are the same. Doing things like chest x-rays, potentially consulting with a cardiologist and doing something like an echocardiogram is going to get you to the bottom of exactly what's going on there.
Great, thanks. Staying on heart murmurs for a moment, what options might be available to treat heart murmur? Is there any surgical intervention, or what research is coming out around heart murmurs?
Yes, so I am kicking myself for not including any mention of surgical options in this talk, because you are totally right. There are more and more both medical and surgical options being investigated for any cause of heart murmurs in dogs and cats all the time. And so one that you may have seen that we have been investigating, one surgical option that you may have seen that we had been investigating here at the University of Minnesota for that mitral valve condition was something known as transcatheter edge-to-edge repair of the mitral valve, or TEER. And that's something that many centers are still investigating for the exact right use of that surgical option in dogs with mitral valve disease. Our center is not currently doing that procedure for patients with this condition, but if your dog is a good candidate for that procedure, we're certainly more than happy to chat with you about how to go about getting that procedure done. At the end of the day, again, I'm struggling to be succinct in my answer, but yes, absolutely. Many centers are looking into surgical options for these conditions. And then if your pet has a congenital heart defect, those are often treated with surgical options, the vast majority of which we are able to do here at the University of Minnesota. So that's certainly a reason to schedule an appointment with our cardiology team here to talk about all of those options. And you can read on our website, I put that little QR code, some of the novel surgical procedures that we've done for some patients with congenital heart disease recently.
Thanks so much. Moving over to heartworm. This person says, my dog was treated for heartworm. Are there long-term impacts on heart health after having that diagnosis?
Yes, great question. The short answer is unfortunately, yes, there can be. long-term consequences of that heartworm condition, which is why prevention is much preferred to treatment. But I acknowledge that prevention is not possible in all circumstances, including many of our beloved pets are adopted because they were strays found on the street where they certainly were not getting heartworm prevention. And so it is important, and you can talk with your veterinarian if your dog or cat is diagnosed with heartworm disease. It is important to know that they can have long-term impacts on their heart. And the best way to assess for whether or not that may occur is to do that echocardiogram, that cardiac ultrasound test, which is something that we do here at the University of Minnesota. There are other options for doing that as well. The biggest long-term impact that we see with that condition is the development of something known as pulmonary hypertension, so high blood pressure in the lungs. And we often can manage that medically, but it does require medications.
Thanks. Moving over to medication. This person wonders, can medications like progesterone, Xarelto, or cyclosporine cause heart issues?
Good question. There are certain medications that have been associated with causing heart disease. The medications specifically mentioned are not typically associated with heart disease, thankfully. In fact, we even use Xarelto to manage blood clot risk in cats with heart disease. So we are occasionally using that medication in pets with heart disease. There are other medications that can cause heart disease. That is something that your veterinarian should be talking with you about anytime they're starting your pet on a medication, is what sorts of risks are associated with that. The biggest one that we see cause heart disease in our pets is a chemotherapeutic drug. So not one that's used all that often. But if your dog or cat has had chemotherapy with a drug called doxorubicin, you may be familiar with the caution in using that those patients can start to develop heart disease if they get that medication for a long time.
Sounds good. This question asks about mitral valve disease surgery. What is the latest data on the effectiveness of mitral valves?
Yes, you cut out a little bit on my end. Hopefully that was just for me, but the latest data on mitral valve disease surgery falls into two buckets. So one of the surgical options for mitral valve disease is that TEER procedure that I had briefly mentioned. And that data hasn't been published yet, but the centers doing that procedure the most commonly have presented some data at conferences on that shows that that procedure in the right case, it's very case selective, unfortunately, so that will involve discussion with a cardiologist. But that data suggests in the right cases that that procedure can be up to 90% effective, so very effective. And then the other option for surgical treatment of mitral valve disease is open heart surgery and physical correction of the valve, so open heart repair of the valve. And that is currently being done in this country, just at the University of Florida. But that is also not published data yet, unfortunately, but they are seeing similar success rates. So upwards of 90% success. We have patients here at the University of Minnesota that have done both of those options and have been very successful. So we have our own batch of anecdotal evidence here at Minnesota that fits with that.
Thanks. I think my internet's back, so here I am.
Okay, I was hoping it wasn't me.
No, it's me. This one is about prevention, and is checking the color of my dog's gums a good way to determine cardiac health? And does it matter when you're checking when the dog is at rest or after exertion?
This person did their homework before the presentation. So yes, gum color can be really helpful in telling us whether or not our pets' hearts are functioning appropriately, because they should be the same color as our gums, right? If we're taking good care of our dental health, they should be that nice pink, deep pink color. And if they're not, if they're really pale or if they're blue, then heart disease would be one thing that could cause that. Unfortunately, there's other things that can cause that too, so you will need to bring your pet to a veterinarian to see which of those things is happening. But that gum color can be really helpful, and that truthfully can be at any times. They can be resting, they can be up, moving about. What you'll see is if they've been just doing really vigorous activity, for instance, that their gums will often be a darker pink color. But if they're not that, then that would also be, could mean that they are having some sort of problem with their heart's function.
Sounds good. Okay, we have a question here about prevention and the use of imaging. This person says, if I had known how common heart disease is, I would have chosen to do an echo scan as a routine with all of my cats to get an idea of any potential issue. What do you think of that approach?
Yeah, I mean, I'm biased, right? I'm a cardiologist. I wish I could do an echo on every animal alive. So that would be great, right? But I acknowledge that that's not always possible in all circumstances. And so one additional helpful tool that is more accessible than an echocardiogram are those cardiac biomarker tests. So I mentioned when we do the cardiopulmonary auscultation, if there's any abnormalities, one of the things we might recommend are those cardiopulmonary or are those cardiac biomarkers. And in cats, that NT-proBNP test has been shown to be quite sensitive and specific for heart disease in cats and early detection of it. So that's something that if you don't have access to annual screenings with an echocardiogram, that can be just as beneficial. But you're right. I mean, it's never wrong to do an echocardiogram because it's a non-invasive test. It's an ultrasound. There's not a lot of downsides to it other than that it is not free and it is not accessible in all instances. So the cardiac biomarkers are a really promising tool, and there's more research going into that every day. Maybe we'll find an even better one eventually, but that's a blood test that your local vet can do for you at any time.
Thank you. This person is asking about watching for symptoms and when a pet collapses. This person says, what should I do if my dog collapses? Is there something we can or should do immediately before taking them to an ER?
Yeah, it's a good question, and I want to be sensitive to that question because I hope no one out there has seen their dog faint or collapse, but it's really hard to see. So I just want to be really forgiving with any action that you take in that moment because that's really shocking thing to see with your pet. So rest assured, there's nothing that you need to jump and spring into action to do in that moment. If they're having a fainting or collapse episode, they should get back up. But you're right, getting them to a veterinarian, ideally a veterinarian with emergency stabilizing capacity, is going to be really important then, because unfortunately, in some dogs that have fainting and collapse, they can pass away, they can die suddenly from that. And so it is an emergency. Getting them to a vet, keeping you and them safe. Some dogs are heavier than others, so no throwing your back out, getting your dog to the vet is important. There's unfortunately no really other thing that you can do to help support them in that time.
Thanks. This one comes from someone who submitted this evening. If a pet has many of the signs of heart disease, such as fast or difficulty breathing, but testing has ruled out heart disease, what other conditions are common that may have similar symptoms?
A great question. So, of course, none of the signs I talked about tonight are exclusive to heart disease. If they were, probably wouldn't need a veterinarian because we would just know exactly what's going on, right? So, um, heart disease is one of the scariest things that can cause that, and that is why it's usually what we try to rule in or out first in those patients. And then if that's not what's going on, it does depend a little bit on whether we're talking about cats or dogs, and even truthfully, what breed of dogs we're talking about. But in general terms, the next most likely thing to be causing that is some sort of abnormality with the lungs or airways themselves. So conditions like asthma, chronic bronchitis, collapsing trachea or collapsing airway disease. And then we can also just see that in certain, specifically breeds of dogs, but some breeds of cats that have what we call brachycephalic syndrome, where they have really shortened nose. So that's kind of like our bulldog breeds, our pit bull breeds, our Persian cats. Those patients can also have difficult breathing because of that brachycephalic syndrome.
I think we have time for one more here.
Wonderful.
This person says, my dog has been diagnosed with kidney disease and heart disease, and it seems like treating these two conditions can be at odds at times. Do you have any advice for treating an animal with multiple conditions?
You are completely right. Every option that we have to support the kidneys hurts the heart, and every option that we have to help the heart hurts the kidneys. And so those can be quite challenging cases to manage, as I'm sure whomever submitted this probably knows very well. And so in those cases, many times your veterinarian will be comfortable managing those conditions together because we do see them both commonly. But that can be a really good time to, if you are able, see a cardiologist, because those are exactly the types of nuanced cases that we can help to balance. And so yes, I don't have a magic solution for you. That is a big challenge, and I'm really sorry that you're having to go through that with your pet.